So let me first introduce myself. My name is Arun Kumar Prasad and I am a dermatologist by profession. My experience in this profession is of about 43 years and I am mostly dealing with clinical dermatology and a little bit with cosmetic dermatology as well. We will have a short talk on hair loss. Yes, so we do need to understand that hair is normally lost every day. As per the textbooks, even a loss of 100 hairs every day can be considered normal. However, we need to understand that if only 20 hairs are lost every day and none of them are getting replaced, then we will after some time see that our scalp has less hair. However, if 50 hairs are lost every day but all of them are being gradually replaced, then we are not going to actually see any thinning of hair on our scalp. So this is something that we need to understand. Accelerated hair loss but followed by replacement of the lost hair doesn't really require treatment, but not so copious hair loss but with very little replacement will require treatment. Yes, the hair loss can be due to many reasons. Nutritional deficiencies, any kind of serious illness like typhoid fever. During the COVID times, we used to see a lot of COVID-related hair loss. Any serious illness, even an operation, can lead to hair loss. And also, after childbirth, say about 3 months after childbirth, we also see a lot of hair loss. But apart from that, we also see what we call patterned hair loss. So the hair loss occurs in various kinds of patterns, and usually this is not accompanied by any preceding disease or childbirth. So we call this usually we call it androgenetic alopecia. So what is the meaning of androgenetic? The genes definitely play a role and we get a positive family history either from the paternal or the maternal side. Androgen basically means the male hormone. So obviously men are more prone to androgenetic alopecia because obviously being men, they have a lot of male hormones. But even ladies normally have male hormones, but due to certain conditions like polycystic ovarian disease, the secretion of male hormones may increase, making them more prone to developing hair loss. Yeah, so I would say hair fall means that, okay, some hair is being lost every day, but hair loss means so much hair is being lost and it is not being replaced that we can see thinning of the scalp. Yes, if anybody is having hair loss, I would suggest that they seek the advice of a dermatologist. Number one, I would like to say that a dermatologist does not only treat the skin, he also treats the hair, the mucous membrane and the nails. So we don't need to look for a hair specialist, we need to look for a dermatologist. And it is also important to start the treatment as early as possible. The reason being, we cannot expect all the lost hair to be replaced. So if a patient has extensive areas of baldness, with the treatment he may get back a good quantity of hair, but he may still feel that it is not enough. So bald patches may still be visible. So if we start early, then we will not have, in all probability, bald patches at all. So, as a dermatologist, I am practicing at Wizderm Clinic, Jodhpur Park, and Wizderm Clinic, Shakespeare Sarani. And anybody who is interested in having a consultation about his or her hair loss, they can get in touch with these clinics.